Hello and welcome to another episode of Health Digest, a program that brings to you news analysis, development on everything that concerns your well-being. I'm Ogom Ezidimbo. And now, for those who are used to using their AirPods, have you ever thought of the dangers associated with extended use of AirPods and headphones and what you can do to protect your ears? Well, that's our focus on the program today. But first, let's bring stories around the health sector.
On Health News today, the federal government, through the National Primary Health Care Development Agency, has inaugurated a new National Emergency Operations Center team aimed at accelerating the eradication of polio in Nigeria. The inauguration, which took place in Abuja, where the Executive Director, Dr. Muyi Aina, charged the team to adopt a problem-oriented approach and rely on data-driven decision-making to strengthen national response efforts. Dr. Aina emphasized the importance of structure, teamwork, and accountability in achieving measurable results. He noted that all operational outcomes and strategic decisions from the NEOG would be routed through technical working groups to ensure proper coordination and feedback.
We want to re-empower the NEOC to do what an NEOC should do, which is a delivery unit. There's a command and control structure for any emergency response. And so we're re-centralizing decision-making for the polio program at the NEOC. All of us will weigh in. All of our institutions have capabilities and contributions to make. All of our friends and other working group members, will provide input. But the decision making for the polio program will sit in the NEOC, and none of us will have the ability or mandate to go out and pursue institutional alternatives. I think that's one of the things that we're hoping to rally everybody around here.
The newly inaugurated 36 team member will be led by Dr. Audu Musa Idowu, Dr. Adiola Oluwatoyin, and Dr. Shino Alade Shawe, and is expected to focus on practical actions that deliver timely and effective outcomes.
I strongly believe that if we're able to do this, the road of polio virus interruption is going to be smooth and easy for us. But let me say clearly that, of course, there will be challenges along the line. But with teamwork, dedication, we will get there. We are assuring you this morning that we are going to work as a team based on the guides of this reforming. Strong accountability, data-driven decision-making, more presence in the fields, and acknowledging local innovations to be able to achieve our interventions.
The NEOC, established in 2012, serves as the central hub for coordinating polio eradication activities across the country. Nigeria has recorded a remarkable progress with a 35% reduction in circulating variant polio virus type 2 detections in 2025 compared to the previous year. Health authorities explained that the improvements reflect sustained surveillance, vaccination campaigns, and strong collaboration with partners. With continued support from the World Health Organization and other stakeholders, Nigeria is targeting a complete interruption of CVPCV2 transmission by 2026. Nigeria's Federal Ministry of Health and Social Welfare has expressed commitment to creating a sustainable, ethical environment for health research in the country. The Minister of State for Health and Social Welfare, Dr. Isiaq Adekunle Salako, conducted a National Health Research Ethics Committee training workshop in Abuja. He said the ongoing trial regulation and clinical ethics optimization project designed to improve the integrity, safety and rigor of clinical trials in Nigeria and other participating countries is a welcome development that the Federal Ministry of Health and Social Welfare will ensure we build upon to create a sustainable, ethical environment for health research in Nigeria. He also said that the government of President Bola Ahmed Tinubu is committed to encouraging and funding local research for new drug development, vaccines, and disease epidemiology. He said the government is aware that this commitment can deliver optical benefit to Nigerians and contribute to the global agenda of good health and well-being for all in an environment of ethical research conduct that protects participants, ensures data integrity, builds public trust, and upholds the credibility of science. The minister highlighted that research ethics in Nigeria, like in many other African countries, was not receiving the attention it deserved until the establishment of the National Health Research Ethics Committee in 2005 and its formal enablement 9 years later by the National Health Act 2014. It said the National Health Act empowers the NHREC to oversee ethical approval, provide guidelines for ethical conduct in research, especially when human subjects are involved, and monitor health research to protect participants' rights, safety, and well-being. Dr. Salako added that since the inauguration of the new NHREC under the chairmanship of Professor Richard Adegbola, the committee has been working very hard to raise the bar for ethical health research by overseeing and ensuring the timely approval of health research proposals nationwide. He called on NHRC members to redouble their efforts and accelerate the movement towards a fully ethical, compliant health research environment in Nigeria. The Nigerian Academy of Science says without a functional system that links laboratories to the market, innovation will struggle to translate into national development. According to the Nigerian Academy of Science at an event in Abuja, Nigeria risks falling further behind economically if scientific research continues to remain disconnected from entrepreneurship, commercialization, and job creation. President of the Nigerian Academy of Science, Professor Abubakar Sambo, explains that the disconnect limits the ability of science to solve real economic and social problems despite the strong human capital.
As scientists, policymakers, and stakeholders, we must work together to create an environment where research outputs are merged with industrial needs, where innovations find pathways to the market, and where knowledge generates wealth and employment. Our goal is to position Nigeria as a hub for scientific excellence and technological advancement in Africa. Nigeria's scientific community has made notable contributions in the fields of artificial intelligence, in agriculture, in healthcare delivery, and energy, especially renewable energy, and so on and so forth. We must ask, how do we ensure our research is relevant? How do we bridge the gap between discovery and commercialization? This conference will explore these questions and much more through keynote and lead presentations, as well as the contributions from several sessions. We shall succeed. We shall hear success stories, identify challenges, and chart a course for leveraging science to drive economic diversification and job creation. As we deliberate, let us focus on actionable outcomes. Let us identify policy recommendations, potential collaborations, and strategies for resource mobilization. Let us ensure that our collective efforts translate into tangible impacts, new products, new companies, and new jobs. To the young ones that I've seen quite a number in this hall, I want to say that your contributions are crucial. The future of Nigeria's knowledge economy depends on your innovative ideas and dedication.
The keynote speaker, Abiodun Awoshika, noted that without intentional structures connecting universities to industry, research will continue to exist in isolation, limiting its commercial and employment potentials. She insisted that positioning universities as innovation hubs and creating a research market workplace would allow science to respond directly to real market needs.
How do we reconfigure the structure in a way that we're able to commercialize the work that science institutions or science departments or science faculties or research institutions can do in a way that they directly impact the economy of the nation? I would say one of the key things is we need to have a science and research marketplace. What is a science and research marketplace? This is the National Academy of Science. Once a year, we have the conference, but outside of the conference, we have another event. A huge event closer to market, I dare say. Abuja might be good for the conference, but when you want to do a marketplace event, you want to be closer to the market. And therefore, where is the market? Find a location closer to the market. Organize an exhibition of research going on in different institutions and the economic viability of them, the problems they're trying to solve and the solutions they're preferring, where they are and where they need to go, and create a marketplace where the market comes to search for partners for what they are trying to solve. And in connecting those two, connecting market and connecting science together in one place, we create for ourselves a better chance.
Some of the experts argued that the reliance on imported solutions has further slowed progress in sectors such as agriculture, industry, and the environment.
Africa is endowed with abundant human and natural resources, but the continent remains largely underdeveloped because it is plagued with many problems that negatively affect socio-economic development. The same can be said of Nigeria, where a cluster of problems work together to impact negatively on development. But these problems can be solved easily if research informs policy and practice. The theme for this conference, from research to markets, the making of knowledge-based economies, is apt and will surely generate discussions on research translation. The network of African Science Academies, NASAC, is poised to strengthen networking among national academies in Africa to promote sustainable development.
For these science experts, the missing link remains collaboration, and unless Nigeria strengthens the link between research, policy, and industry, scientific innovation will continue to fall short of its potential to drive economic growth and job creation. The New African Magazine of the United Kingdom has recognized the Chief Executive Officer of the MEC Foundation, Senator Dr. Rasha Kelej, as one of the 100 most influential Africans for 2025, in recognition of her outstanding contributions to transforming healthcare and empowering women and girls across Africa and Asia. Dr. Kelej shares this prestigious recognition with African leaders, including the President of Angola, South Africa, and Ghana. This marks her 7th consecutive year on the influential list, underscoring her sustained impact on public health, education, and social change. Speaking on the recognition, Senator Dr. Rasha Kelej described the honor as deeply meaningful, noting that it reflects years of collective effort to strengthen healthcare capacity, empower women living with infertility, and promote girl child education. Through the MEC Foundation, Dr. Kellege has led groundbreaking initiatives focused on education, healthcare, and mindset change. The foundation has provided 2,500 scholarships, including 770 specialized clinical training scholarships for healthcare providers from 42 countries across Africa and Asia. These cover fertility care, embryology, sexual and reproductive medicine, women's health, psychiatry, biotechnology for assisted reproduction, urology, laparoscopic surgery, and family medicine, critical areas for advancing equitable and quality healthcare for women. Beyond clinical training, the MEC Foundation has also supported childless women through its Empowering Banner program, helping beneficiaries establish small businesses and achieve financial independence. According to Dr. Kellege, the goal is to ensure that every woman is respected and supported to live a fulfilling life, with or without a child. Education remains a central pillar of Dr. Kellege's advocacy. In partnership with African First Ladies, the MEC Foundation has awarded over 1,200 annual scholarships to high-performing underprivileged schoolgirls from 19 African countries, enabling them to complete their education and reach their full potential. Beneficiary countries include Nigeria, Ghana, Kenya, Liberia, Tanzania, Zambia, Zimbabwe, and the Democratic Republic of the Congo, and several others across the continent. That's it on Health Digest. I am Oebimpe Wealth.
And now to our focus. EarPods and headphones have become part of our everyday lives, from early morning commutes to workouts and long work hours and even bedtime. And many people stay plugged in, listening to music, podcasts, movies, or taking calls. But while these devices offer comfort, style, and convenience, health experts warn that prolonged and improper use could be silently damaging our hearing. On Health Digest today, we examine the dangers associated with extended use of earpods and headphones and what you can do to protect your ears in this report. From music to podcasts and even calls, these devices have redefined how we consume sound. They come in different shapes and sizes, fitting snugly into the ear or resting over the head. But behind the convenience and popularity lies a looming danger. The World Health Organization warns that listening to sound levels above 80 decibels for more than 8 hours daily can damage hearing. At 85 decibels, the safe time drops to 4 hours. Just 3 decibels higher, at 88, it reduces to 2 hours, and the higher it goes, the less time it takes for hearing loss to occur. For many Nigerians, however, the convenience outweighs the risk.
Basically, I love my volume to be at medium level, but if I discover that I'm not actually hearing what is coming out very well, I increase it, but not to the mass.
But most times I feel like my ears have this ringing sounds. Maybe it's from the result of overusing of it. Yeah.
But basically I use it for music because I love listening to music. It inspires me a lot. So when I want to really get every beat in that music, I use the AirPods so that I can get everything. I mean everything in the music.
Dr. Ifoma, a consultant ear, nose and throat, and says many young people increase volume levels, especially in noisy environment, without realizing the long-term consequences.
Now the AirPods, you know how it's designed, right? And commonly you find people wearing it as if it's an accessory. The part that generates or produces the noise or the sound is directly sitting in the ear canal, and that projects sounds at very loud intensities into the ear canal and then onto the other parts of the ear, and it can affect the sense organ for hearing, which is the hair cells. These are very sensitive cells that noise can kill, and most times it can cause a permanent damage, so you can't regrow them. and that is where the problem lies. Now, people may think it's nothing, but you have that even those that produce these devices and even cell phones these days, when you increase the volume, it warns you that you can't listen more than this volume. It tells you that, at least it prompts you. You also have sometimes when, like those that have the smartwatches, the smartwatch will tell you if you're in a place with a loud noise. Now, these AirPods or EarPods sitting in the canal increases that risk.
Nigeria is already facing a substantial burden from hearing impairment. According to the Speech Pathologists and Audiology Association of Nigeria, about 8.5 million Nigerians are currently living with hearing loss. Professor Agoda, a cochlear implant surgeon, explains that treating hearing loss is extremely costly.
Hearing aids are from thousands to millions, and depending on the way it looks. If you want the customized types, they are quite expensive. Now, when hearing aid cannot help you, cochlear implant, which does miracle and makes the deaf to hear. Right now, as I'm talking, if you have to do 2 ears, it's going to cost close to 40 million, because these devices are not made in this country, they are imported, and you have to sell them in dollars. If you sell them in naira with the fluctuating figure values, so the devices come in dollars, but the other things that we do, investigations, the surgical fee will come in our own currency.
With the average Nigerian worker earning far less, he stresses that most patients cannot afford such interventions, making prevention the only realistic option.
The average cost which most of our workers take home in this economy cannot really help. So it's a very challenging thing, and it's rather better to prevent it than to have it. Otherwise, the person will just be a dependent and add more to our social issues.
So the advice is simple. Prevention is the best defense. That means keeping the volume low, taking listening breaks, and avoiding prolonged use, especially during sleep. So next time you want to plug in your AirPods or headphones, remember, protecting your ears today could save you from a lifetime of silence tomorrow. And your hearing is precious, and once damaged, it may never fully recover. Simple habits can make a big difference. We'll now bring you a healthy tip segment, and today our focus is on water and its importance.
Water helps the body in many important ways. First, it regulates body temperature. When we sweat, water helps cool the body, especially in hot weather like we experience in many parts of Nigeria. Without enough water, the body struggles to maintain a safe temperature. Secondly, water supports digestion and nutrient absorption. It helps break down food, prevents constipation, and allows nutrients to move easily through the bloodstream to different parts of the body. Water also helps play a key role in kidney function. The kidney relies on water to flush out waste products and toxins through urine. When water intake is low, waste can build up, increasing the risk of kidney problems. Beyond physical health, water is important for brain function and energy levels. Even mild dehydration can cause headaches, tiredness, dizziness, and difficulty concentrating symptoms many people ignore or mistake for stress. So, how much water do we really need? While individual needs may vary, most adults should aim for about 6 to 8 glasses of water daily and more when engaging in physical activity or during hot weather. Here are some simple tips to stay hydrated. Start your day with a glass of water. Carry a water bottle when leaving your home. Drink water before you feel thirsty. Reduce sugary drinks and replace them with water. In a world where many people focus on supplements and medication, we must remember that one of the most powerful health tools is simple, affordable, and accessible water.
And that's our package today, Health Digest. Remember to drink water. It's important for your overall well-being. I'm Ogom. Stay safe.